Alexander, go ahead.
Thank you. Vying for the second longest title there of the day. So this is a study that we performed in southwestern Victoria using behavioural measurements of cow rumination and physical activity to see if there was a relationship between peripartum disease events and measurements of a particular sensor device. So in this study, we chose to use an accelerometer and microphone-based device, which is the SCR HRLD collar. So I'm going to talk a little bit about how this particular device works, some of the particular applications of this research to a system in Australia which differs a little bit from other dairying systems around the world, why we thought research was important, and I'm going to go through the study that we performed, some of the techniques we use to assess these relationships, and finally how we can use this sensor data to predict the presence of peripartum disease in cattle in our system. So we've got an accelerometer that's based on a cow's collar. That has an interpretive layer from a proprietary algorithm which determines whether some triaxial movement of that accelerometer is rumination, when the cow is basically chewing her cud, or physical activity, and it gives that a score for minutes per 2 hours of each of those behaviours. That's then pushed to a computer on the farm which interprets that information as being likely indicative of the presence or absence of a disease. That is moved to the cloud, and then there's an alert that's pushed out to the phone of the dairy farmer in question. So we found that there was a lot of research conducted in these systems in housed dairy cattle, but obviously, as you can see there, we're based in this little part of southwestern Victoria, down on the very, very bottom of Australia. There's a lot of very warm and sunny parts of Australia, but this regrettably isn't one of them. We have a predominantly pasture-based system, and we feed concentrates, slugs of grain like wheat and barley through the dairy at fairly high levels every day. We predominantly calve seasonally, and we have quite a large herd size in our area. So we look at herds of between 450 to 500 cows, moving up to 1,000 cows, predominantly on a pasture-based diet. So we question the applicability of some research in house cattle to our systems, because our cows are moved to the dairy twice a day. They walk multiple kilometres to get there. They have very different patterns of consuming feed, and they therefore have very different patterns of rumination and very different patterns of movement. So we thought that fresh cow health monitoring programs are somewhat easier to apply in a setup where you have a barn and you have head lock-ups to monitor those animals, but much more difficult in our systems in Australia. So we thought that perhaps these systems could have a role in aiding that process of detecting when commercially significant diseases were occurring in our animals. So we recruited 168 cows in our study. We enrolled them over a single calving season, which in our particular part of the world goes from July till November. And on each of those cows, we logged the data continuously from these sensors. So that works out at a resolution of figures in minutes per 2 hours, given at 2-hour intervals, so 12 readings per day. And then a veterinarian did a physical exam on each cow at between 4 and 7 days in milk. We assigned them a vaginal discharge score to check for metritis, a rectal temperature. We used a threshold of 1.2 millimoles per litre of beta-hydroxybutyrate using a precision extra device to see if there was subclinical ketosis, and we examined them for obvious gastrointestinal disorders like abomasal displacement. And the aim of the study was to marry up this data and to see what the relationships between sensor measurements were and the diseases that we were seeing. So a little information on the prevalence of the diseases that we saw. Interestingly, this figure of 17 to 19% of ketosis is something that occurs across multiple systems, and our particular study was no different. About 10% of our cows had metritis. We had an unfortunately high prevalence of mastitis in a very wet season in this area, and about 2% of our cows, or 5 cows, had an abomasal displacement. We had issues with the sensitivity of the missingness of the sensor data in this particular study. The integrity of the data was really impinged upon by the fact that our farm was very hilly and it was difficult for tags to communicate with the the base station to communicate their measurements. So we had to eventually exclude 37 cows from that data set, so we ended up with 131 cows in our final analysis. We then constructed a database and linked our physical examination data to the sensor data and access, and we did two statistical analysis techniques. One to determine the relationship between the sensor measurement and the presence of the health disorder using continuous variables of rumination time and daily activity time and the presence of a disease at days 4 to 7 in milk. And we did a multivariate linear regression to do that. And there was autocorrelation and repeated measures, and we used the LME package in R to do that. We also performed a logistic regression model to determine what was the predictive value of these devices in determining and identifying health disorders. And what we're really interested there is identifying health disorders precociously. We send our cows into a paddock every day and we can only get them back 2 times a day. So there's a lot of value proposition for our farmers in being able to identify a cow as sick before she's obviously sick so they can draft her for assessment and treatment. And we really wanted to find out what the role of these sensors was in being able to bring that to the farm. So let's have a look at some of the outputs of our linear regression model. So what did we find? We looked at ketosis, subclinical ketosis, abomasal displacement metritis, the effect of being a heifer, a primiparous cow, retained fetal membranes, and things like hypothermia and pyrexia. So basically, there are marked really significant declines in things like abomasal displacement. So we go from 450 minutes of rumination a day, and per 2-hour period, 10 minutes less of rumination time for those cows that are ultimately affected by an abomasal displacement. And our confidence intervals there don't overlap 0. We have a nice significant finding with a fairly reasonable effect size. We saw the same thing for retained fetal membranes, and these are both diseases that are relatively severe in their clinical presentation. Our RFMs are often accompanied by acute metritis in our cows, so the cow is often physically ill at the time and her milk production has started to decline. Subclinical ketosis, we have minor reductions in rumination time, not significant, and the same thing for hypothermia and pyrexia. So what does that tell us? If we have a relatively severe disease process, this is a really useful piece of information coming off this tag because there's a strong relationship there that can subsequently be used for prediction. But there's smaller and non-significant declines for minor health disorders, so the role of that information is a little bit more questionable. What about physical activity, the other measurement that's coming off our tags that isn't rumination? Again, for disorders like abomasal displacement, and in this case, metritis, cows with a really high temperature and a red vaginal discharge, we have really significant and fairly marked declines in rumination time. And interestingly, our heifers turned out to be more active, presumably for behavioural reasons involving access to feed. So what does this mean in terms of what's happening in these cows? So in the case of an LDA, this on the x-axis is the days relative to when I examined that cow, and the rumination time in minutes per 2 hours on the y. That green line is a smooth line of our normal cows, and the red line is our cows with an LDA. So our cows with an LDA are ruminating a lot less well before that physical exam was performed. And you can see the amount of noise in that data. That's our raw data for rumination behind that cow there. And what about physical activity? There's no clear pattern there, which can possibly pose issues later on when we're trying to use this data for predictive purposes. But we see that our cows affected by LDA do in fact have a lower degree of physical activity, again, well before that physical examination occurs. So, the million-dollar question, can we use these to precociously predict things like LDA, which are really costly health disorders for farmers? So we did a logistic regression model. We used data that's available to the computer system rather than its commercial algorithm. So we have rumination, physical activity, age, and the parity of the cow. So what do we get? We get a classification model using a training set and a testing set that has a sensitivity of about 81% and a specificity of 85% for correctly classifying an abomasal displacement. and the area under the curve of our rock curve there of 0.91, which means it's a model with reasonable diagnostic efficacy in this circumstance. It's of some use for classifying these cows as having an LDA, in this case 2 days prior to the clinical diagnosis. So we're seeing that for those disorders where there was a marked relationship present, we can apply some models and use that to predict abomasal displacement. But let's look at metritis, where we had one significant finding for activity and a non-significant decline for rumination. And we get a model with a sensitivity of about 52% and a specificity of 62%. So at that point, with that nice flat rock curve, you may as well flip a coin to decide whether this cow has metritis based on the sensor data. So a less well-performing model there. So we've seen that there are biologically plausible marked declines in rumination present, and the sensor measurements are related to the presence of peripartum disease in cows in our herds. We think there's some application for determining the presence of things like severe gastrointestinal disease, but there are some limitations to using single sensors for behavioural diagnostics. There's a few reasons we might be seeing these relationships. Cows that eat less move less and ruminate less, and cows that eat less are likely to be sick. Prostaglandin release depresses appetite, physical activity, and anything that suppresses dry matter intake is suppressing rumination. I think in our study, in a pasture-based herd, changed social dynamics, how cows move in a paddock, play a really important role, as pain-related behaviours do as well. And I think one major metabolite that we could have assessed in our study was hypercalcemia, because I think that's a really significant factor that's influencing both rumination and activity in our cows. But we do see that there are some implications for using these things for our clients for detecting, the presence of moderate to severe diseases, if not mild disease states. I'd just like to quickly acknowledge the help given by the University of Melbourne and Dairy Australia and the vet group, and of course the farmers who generously gave their time and cows to my study. Thank you.